Good afternoon. We begin today with something Idaho medical leaders are calling dire. We are talking about our healthcare system, which has become overwhelmed of late by the virus. We have team coverage this afternoon as we continue to follow breaking news. The entire state of Idaho now under crisis standards of care. This comes about as hospitals and ICUs all around the Gem State are filling up very rapidly with very sick people fighting a battle with COVID. The state's healthcare managers weighed in on the status of the system today and what's happening right now and what needs to happen next. Our Joe Paris listened in on what they had to say and joins us now in the studio with that. Joe.
Well, Mark, we're in a crisis, plain and simple. This morning, St. Luke's Health System formally requested to go into crisis standards, and soon after, the Idaho Department of Health and Welfare announced that they were activating those crisis standards of care. I'll explain more in a minute exactly what this all means. Hospital beds, ventilators, medicines, other things are going to be rationed. We'll get into some more details in a second, but hospital leaders painted a sobering image for us about what this means for communities around Idaho. We heard about how it was an incredibly sad day for the St. Luke's community, for the state of Idaho, and really for the region. They told us that since the beginning of the pandemic, they've been prepared, they've been planning, and they've secured the supplies, equipment, and bed space that they need. However, at this point, it has gotten to the point where they've run out of options. They also tell us that they've been working as hard as they can to avoid this, but they have just been under such heavy pressure with continued COVID cases, a surge, very sick people needing dire treatment. A large majority of them, they tell us, are unvaccinated. In more detail now, here's what crisis standards of care entails. According to the Idaho Department of Health and Welfare Director Dave Jepson, he said, quote, "It's a last resort, and under it, it's possible that non-urgent or less urgent care will have to wait so that hospitals can deal with life or death emergencies." For a crisis standards of care plan to be activated, Health and Welfare tells us that some, or at least some of the following must be true, and now they are. Things like not having enough resources to provide the usual standard of care. Typically, multiple healthcare organizations within a community would be feeling the strain. Well, we're at that point right now, as we heard from hospital leaders and medical leaders a short time ago. They also tell us that patient transfers may also not be feasible at this time, and there also might not be enough available staff to adequately deal with the volume of patients that are coming into our hospitals and our ICUs and our ERs. They also tell us that things like vaccines, blood products, or antidotes may be unavailable, or they may have a depleted supply, meaning there could be rationing at some point. They also tell us that there could be other disruptions to the healthcare supply chain, things like oxygen supplies. We know that there's a large tank shortage nationwide. If you want to have any more details in front of you and really an in-depth look, you can get everything you need to know about crisis standards of care on our website right now, ktvb.com, or you can get it texted directly to you. You can text the word CARE, C-A-R-E, to 208-321-5614. And Mark, I really don't know how to say this any other way. We are in a worst case scenario for our medical system. Last year, healthcare leaders feared at hitting this point. There was fear about a year ago heading into November and December that we could hit crisis standards of care. We never hit that point in late 2020. Healthcare leaders told us at that point that if we did, it would be a community failure. Well, Mark, if you fast forward about 10 months, that's where we're at now in September of 2021.
Joe, a lot of people are having trouble wrapping their head around exactly what this means, and they want to bottom line this. Say you fall off a ladder, cleaning your gutters, you break a collarbone, you go to the ER. Is there a chance that you will not be seen and treated because of what's going on right now?
At this point, Mark, in the Treasure Valley, we know that if a situation like you just described happened, there's a really good chance that someone may have to be waiting in pain without treatment until there's simply enough resources or space to deal with them. What they try to do is they try to really order this, and they really try to prioritize the care based on the document the state has put out, saying that sometimes there is prioritization of care based upon a whole set of different requirements. Long story short, though, and to sum this up, if you're needing urgent care, there may not be enough resources to treat you at this point. So you need to be careful. They're calling on the community to do what they can about COVID, mask up, get vaccinated, etc., but also asking people in the community to be safe with things like extreme sports.
It's so sad that we're asking our medical staffs to prioritize worst case scenarios and give everyone a ladder on who is in need of care the most. That is really, really sad. All right, Joe, thank you. With more now on how this will impact Idahoans in their day-to-day life, We turn to our Andrew Bartline. He has been on the streets of Boise today, getting the pulse, if you will, of Idahoans. Andrew, what's the overall take on this?
Yeah, Mark, it's really a wide net, the reactions and responses I've heard from people today. Some say that enacting crisis standards of care, they don't really expect it to impact them that much, whereas others are a lot more concerned. That second group that's more concerned, they really reference some mitigating measures that maybe they lost sight of. They're going to focus more toward that now. Masking up, avoiding large crowds, but this goes beyond COVID. It could be driving, so really mitigating any measure you can to stay out of the hospital and reduce your risk. Now, we spoke with one woman who says she's already seen how overrun the hospitals are, and because of that, she really wants to stay away.
Last night I actually was at the St. Luke's ER in the evening with my mom, and now I'm wondering if our experience is a reflection that there was some delay in our care and our discharge. We were there for longer than we expected.
There are a lot of things that people could do to hopefully stay out of the ER and out of the hospitals in general.
I've had both vaccines and I stay out of crowds. I wear my mask if I'm inside, that's all I can do.
I've been vaccinated and I'm going to live my life. You know, with a few precautions here and there. Maybe I'll wear a mask here and there, but I'm not going to go hide in the basement either.
Now, as you just heard, not everyone feels the same way about this. Those who aren't overly concerned are pointing toward the perceived risks we face every day. Brought up driving a car, you could get in a wreck. And as we saw with that last man riding a bike, he says he's not going to stop riding his bike. So, of course, it's always a good idea to stay out of the hospital. The folks we talked about today, range of concerns, but nobody tells us they're making any big lifestyle changes. Those who are more concerned are just saying they're being a little more mindful. Mark?
It's the first ever situation for the healthcare system in our state, and for all of us. We're still trying to figure out the navigation through this. All right, Andrew, we'll get back to you in a few moments. In the meantime,